ആരോഗ്യ സംരക്ഷണത്തിന് ഉതകുന്ന വിവരങ്ങളുമായി ഇനി ലൈഫ് ആൻഡ് ഹെൽത്ത്. ഇന്ന് ലൈഫ് ആൻഡ് ഹെൽത്തിലെ വിഷയം ഒരു എമർജൻസി ആയി വരുന്ന അവസ്ഥാവിശേഷമാണ്. വെരി ഡേഞ്ചറസ് ഇഫ് നോട്ട് ട്രീറ്റഡ് റൈറ്റ് അവേ, ബ്രെയിൻ അനൂറിസം. നമ്മോട് അനൂറിസത്തെക്കുറിച്ച് സംസാരിക്കുവാനായി എത്തിയിരിക്കുന്നത് ഷിക്കാഗോയിലെ നോർത്ത് വെസ്റ്റേൺ മെഡിസിനിൽ നിന്നുള്ള ന്യൂറോവാസ്കുലർ ഇൻ്റർവെൻഷനിസ്റ്റ് ഡോക്ടർ ധ്രുവിൽ പാണ്ഡ്യയാണ്. Dr. Pandya, welcome to Life and Health.
Thank you very much, Simi, for having me again.
Let me ask you the first question. What are brain aneurysms and how does it form?
So brain aneurysms are basically weakening of your blood vessels in the brain that bulges out. I'll show you a picture of this. If you can see this, normally your blood vessels are like a pipe. But when the wall of the blood vessel gets weakened, it can bulge out and forms like a balloon within this blood vessel, and that makes the wall weaken and risk for bleeding in the future.
What are the causes of brain aneurysm and who are the people mainly at risk?
So there are different types of brain aneurysms, and depending on the type of aneurysm is what the cause is related to. For example, there are aneurysms that can occur in families, what we call familial aneurysms. There are aneurysms that occur spontaneously, and those are usually related to risk factors such as female gender, high blood pressure, smoking cigarettes, alcohol consumption. There are aneurysms that occur because of infections in your body. And there are aneurysms that occurs because of a trauma, and there are also other aneurysms that occurs because you have some congenital conditions that weakens your blood vessels, and the aneurysm occurs at those points.
I know you talked about many risk factors. I have a very common question. Can you get a brain aneurysm from stress or any type of strenuous activities?
From the stress, it's very unlikely that you will develop an aneurysm. But what can happen is that if you have an aneurysm, one of the risk factors for aneurysm rupturing is high blood pressures. So if you are in a tremendous amount of stress and you have an aneurysm, there's a chance that your blood pressure can go up, which can increase your chance of rupture. Now, strenuous activity can lead to aneurysm, because that sometimes can, especially if you are prone to having a vessel injury. And these activity can vary from individuals, but we have seen aneurysm develop in patients going to roller coaster rides, going to chiropractor visits where they have a dissection of the blood vessels, and an aneurysm develops.
How quickly an aneurysm develop? Is there any warning signs for the patients?
And again, that depends on the type of an aneurysm. The familial type of aneurysm that I talked about takes a long time to develop. We usually don't think that these are present in your childhood, but there is something that causes injury to the vessel, and that leads to development of aneurysm over time. The spontaneous type of aneurysm that I talked about also takes a longer time to develop. But the aneurysm related to a trauma, what we call the dissecting aneurysm, or infections, can develop pretty fast. It can occur within days or weeks.
What are the common symptoms experienced by a patient? Can you differentiate emergent as well as non-emergent aneurysms?
When we think about aneurysm, you have to think of it two different ways. One, you have a non-rupture aneurysm that has not caused leakage. The other one is a rupture aneurysm which has caused leakage. Usually the non-rupture aneurysms don't have any associated symptoms, unless it's a really large aneurysm, which sometimes can push on nerves or brain structures, can lead to symptoms. And these symptoms can include headache, blurry vision, double vision, drooping of the eyes, difficulty with movement of the eyes, and very rarely numbness, tingling, headaches, etc. But when you have a aneurysm that leaks, that can lead to a lot of neurological symptoms, and these commonly described as the worst headache of their life. It can be also associated with loss of consciousness, drowsiness, nausea, vomiting, weakness, numbness, tingling, fall, and even death.
ഇത്രയും നേരം നമ്മൾ കേട്ടത് തലച്ചോറിലുണ്ടാകുന്ന രക്തധമനികൾക്ക് വരുന്ന ഒരു അവസ്ഥാവിശേഷമാണ് ബ്രെയിൻ അനൂറിസം. ഡോക്ടർ പാണ്ഡ്യ തന്ന വിവരങ്ങൾ എല്ലാവർക്കും ഉപകാരപ്രദമായി എന്ന് കരുതട്ടെ. താങ്ക് യു സോ മച്ച് ഫോർ കമ്മിങ് ടു ലൈഫ് ആൻഡ് ഹെൽത്ത്, ഡോക്ടർ പാണ്ഡ്യ.
Thank you very much, Simi, for having me.
US വീക്ക്ലി റൗണ്ടപ്പിന് ഇനിയൊരിടവേള.
This Diwali, glow as one with Malabar Gold and Diamonds. Purchase gold or diamond jewelry and be a guaranteed winner.
Everyone wins assured gold coins. Also, pay 10% advance and get protection from gold rate increases. In addition, enjoy zero deduction on gold exchange. Get the best designs at the best prices and be a guaranteed gold winner only with Malabar Gold and Diamonds.
Malabar Gold and Diamonds celebrate the beauty of life.
Primary care for adults and geriatric community. Addiction medicine with latest treatments and immunizations. Dr. Cheriyath Thomas, MD, MBA. Diplomat of the American Board of Internal Medicine. Dr. Bina Joseph, MD. Diplomat of the American Board of Internal Medicine. BCT Medical Services, PC. Suite number 106, 230 Plaza, 230 Hilton Avenue, Hempstead, New York. Phone 516-416-4061.
Hello, my name is Jeremy Carradine, here with Citywide Mortgage, servicing Illinois and now Florida. We're committed to serve our community, and we deliver what we promise. Call us today.
Namaskaram. Attorney Steve Griffiths here. Greetings to the Malayali community and blessings during these challenging times. We understand the unique character of the Kerala community, and we are here to serve your legal needs for all injuries, accident, and wrongful death cases. Call us when you need help. All consultations are confidential. Namaste.
Joseph Dental Clinic, Glenview, Illinois. New and convenient location.
Hello, I'm Dr. Mathew Joseph.
Emergency care, braces, cosmetic dentistry, root canal, crowns and bridges, extractions, gum treatment. Children are welcome. Dr. Mathew Joseph, complete dental care solutions. Joseph Dental Clinic, 611 Milwaukee Avenue, Glenview, Illinois.
US വീക്ക്ലി റൗണ്ടപ്പിൻ്റെ ഇന്നത്തെ ഈ എപ്പിസോഡ് ഇവിടെ പൂർത്തിയാവുകയാണ്. നിങ്ങളുടെ അഭിപ്രായങ്ങളും നിർദ്ദേശങ്ങളും asianetusnews@gmail.com എന്ന ഇമെയിലിലൂടെയോ 7324299529 എന്ന വാട്സപ്പ് നമ്പറിലൂടെയോ ഏഷ്യനെറ്റ് US വീക്ക്ലി റൗണ്ടപ്പ് എന്ന ഫേസ്ബുക്ക് പേജിലൂടെയോ അറിയിക്കുക. വീണ്ടും കാണാം അടുത്തയാഴ്ച മറ്റൊരു എപ്പിസോഡുമായി. നന്ദി, നമസ്കാരം.